Hi, my name's Tara Winward. I'm going to be doing the intradermal injection. I'll be doing a TB test. This is going to be my patient's arm. So first I would verify the medication, verify the doctor's orders, verify the 6 rights of medication administration. So it'd be the right patient, right time, right dose, right medication, right route, and right documentation. The medication dose I'll be given is 0.1 mLs. So I would gather all of my supplies, which I have here. My medication, my gloves, my gauze, my alcohol swab, and my needle. So then I would go down to my patient's room, knock, provide privacy, introduce myself. Hi, my name's Tara and I'm going to be your nurse today. We're going to do a TB test. I'd verify 2 patient identifiers, name and date of birth. Then I would also ask the patient if they had any allergies, seasonal, environmental medications, and then I would, any food allergies as well. Then I would also let the patient know what I was doing here. So I'm here to give a TB test. A TB test is to check for tuberculosis or active tuberculosis, or if you've been exposed to tuberculosis. I would also let the patient know the side effects of the medication, pain and discomfort, itching at the injection site. The patient will feel some light stinging, burning while I'm giving the injection. And then I would perform hand hygiene, put on my gloves, and then so I would clean this off so that way I'm not doing any contamination. Before I drop the medication, I'm actually going to assess the patient's arm, make sure that there's no discoloration, tenderness, any lesions, and then I'm going to be 3 to 4 fingers from the antecubital area, and then I'm going to be about a hand's width away from the wrist to go ahead and give this injection. So then after I verified the patient's skin, I'll draw up my medication. Again, the medication is 0.1. So I clean the top of that off with alcohol. I pull back the air of 0.1. Draw up the medication to 0.1. Verify that there's no air bubbles in that, and that is 0.1. Then I would clean the patient's arm in a circular area from the inside to the out. Allow that to fully dry. And then I would go in. I wouldn't wave my hand like that because I could be spreading germs. So I'd wait till that was fully dry. And then I'd go make sure bevel's up. I'd go in at a 5 to 15 degree angle. Okay, so I'm right-handed, so pull the skin up with that non-dominant hand, 5 to 15 degrees, and then when I inject the medication, I would inject it slowly until I noticed. Inject it slowly, and then I would notice a wheal or a bleb, 6 to 10 millimeters. I'd hold that over. I'd activate this, put this in the sharps container, ensure that there's no bleeding. It looked like a mosquito bite. Then I would get rid of my supplies, take off my gloves, perform hand hygiene again, and then document the procedure. Make sure the patient doesn't need anything else from me before I go. Thank you.